Cash and carry has returned to many health facilities across the country tonight, with the National Health Insurance Scheme left crippled by a collapsed system. Patients are being turned away or forced to pay out of pocket. Some facilities have begun improvising by activating manual claims verification procedures. The head of the National Health Insurance Authority, Dr. Victor Asare Bampo, has been left alarmed following a visit to some facilities to assess the impact. My colleague Papani Ashali joins me in the studio now with more on this unfolding development.
Well, firstly, we know that the director or the CEO for NHI himself is going around trying to assess what the problem is. What again we know is that from our checks is that this is not a one-day thing. This is something some people in fact tell us that at least has been happening over the last 1 week. The exact problem we may not be able to tell, but as with the electronic systems, we know that this particular system that is being used is the National Electronic Health Records and Hospital Management System, a very vital system or platform that the NHIS and the hospitals or health facilities use to enter their claim, to verify their claim, and again, eventually to assess and receive their claims. And this is the system that is currently, that only means that when you go to the hospital, when you're supposed to be keyed in as somebody who benefited from the NHIS for which the hospitals will go and take their claim, this is the system that is now problematic, that for some people, almost 1 week hasn't worked at all.
NHI himself has been visiting some of these hospitals. What are his findings?
Well, we know that he's been to two major places. He's been to the whole hospital again, and then he's been to the regional hospital, trying to assess for himself the situation on the grounds and the impact on it. What we also understand is trying to understand in this situation is to know how exactly we can work around the system as it stands now, and also to proffer solutions how we can move this system forward.
Papa, so what did we find when we visited Egbawe SDA Hospital, for instance?
So we've been trying to understand what exactly this means on the ground at Egbawe Hospital. What we are told is that, you know that when you walk into a hospital, one of the first things you have to go through is to go to records. And at records, what we understand is happening, or what we saw happening at Egbawe, is that if you go to records, the normal thing is for your name to be entered into the system or checked from the system. That system, because it's down now at the moment, we are asked to go through a different system where you now asked to actually pay for some of the services that you have to go through. We spoke to some individuals who had been turned away because they insisted on going through the NHIS system, and unfortunately, because the hospital didn't have it, they asked them to go back to wherever they came from, find an alternative hospital. We can listen.
Process their card, they couldn't. They have to pay physical cash before they can do it for them. So they didn't really say anything. They just told us the system is down and it's everywhere for about 2 weeks. So I heard the nurse was even saying that a gentleman and a wife gave birth in the maternity, and then the prices shoot up, and then the man was complaining bitterly because he thought NHIS will sort part of it. Of course, or if the system is down, they have to do something about it, because you cannot afford. It's not everybody that can afford healthcare without NHIS attached to it. So I think 1,500 or so. Yeah, 1,500. I can't really give the figure, but I don't think that I've even gotten through.
But Michael, I know that you also interacted with the patient. They had their card with them, but still had to pay out of their pockets.
Yeah, so firstly, because ordinarily what we understand is that the NHIS system more or so cuts in half how much you actually expected to pay at the various. In some cases, in fact, absorbs the full cost of your processes at the hospital. You're going to see a doctor and the medication and everything. But in some cases, we know that you have to pay, or the card only covers half. For this particular person that we interacted with, although you have your card, the system is not working. So it means that we cannot lay claim to whatever services we render to you. And at this point, that particular person was asked to go ahead and actually decide to pay for the services. And that particular person actually told us that they had to pay for consultation and again for some of the medication that he in particular was given at the Igbawe hospital that we met him and interacted with him. We can say that, I mean, for some of those who are in those situations, the major problem is that we don't know, and therefore we appear at the hospital banking our hopes on the system that we expected it to work. And that's where the major problem is, to meet with disappointment and ask to go home and finding a solution, not knowing where exactly to actually go for a solution in this case is the biggest problem. We hope that the boss or CEO for NHIS will definitely profess some solutions pretty soon.
Thank you so much.